Hello there, I'm Dr. Perkins, board certified OBGYN, and today we're talking about what causes fibroids during pregnancy. So we will dive into what exactly are fibroids and how does our hormones change during pregnancy, and then how does that impact the growth of fibroids. We'll also talk about what you can do during pregnancy to help your overall picture with having fibroids during your pregnancy. All right, so let's talk about what are fibroids. Fibroids are essentially considered to be benign tissue, meaning that they're non-cancerous, but in general, fibroids could be cancerous. It's just a very small percentage of them. So in general, we'll say about 1 to 2% of fibroids could be cancerous, making a majority of them non-cancerous. Fibroids are a growth. And so if I were to bring my little ball here, I like using these as an example of what a fibroid is like because one, they're white, and fibroids are actually like white little balls that are found or they're growing inside of your uterus somewhere. They can be as small as this. They can be much smaller actually, as small as even a pea. Or they can get larger and they can literally be as large as a cantaloupe or a large orange. And so they can typically grow quite a bit. They're very common. They are actually found in about 70 to 80% of females during their reproductive years and definitely identified by 50 to 60 years old. So the likelihood of you having one of these, maybe even more, is extremely high as a female. Now, these are like smooth muscle tissue, and unless you're, a medicine or someone who's actually like studying the details of what your anatomy is like, smooth muscle means nothing to you. But for us, it just means that it's tissue that is very similar to the other organs that we have inside, and it essentially just balls up into a ball, literally, and one that is hard, one that can grow over time, and one that loves hormones. So now when we flip the script a little and start talking about pregnancy, what do we know is being pumped into our system crazy high during pregnancy? Hormones, lots of estrogens, lots of progesterone, lots of other hormones, all of which can help your fibroids change and sometimes even grow. So these hormones, estrogens for instance, estrogens cause growth. It causes things in general to increase in size, and that includes fibroids. So during your pregnancy, where you have a lot more estrogens, especially in the first trimester, it is very common that your fibroids, whether or not you were aware that they were there, increase in size because estrogens are being pumped in your system, and estrogens are like food for fibroids. The same thing actually happens with progesterones. Progesterones may impact them, not necessarily as directly, but in general, when you're growing a pregnancy, your body is working so hard at making new blood vessels, increasing your blood flow. It is increasing the anatomy or the tissue within your muscles of the uterus. And so while your body is actually focusing on doing the things that it needs to do just specifically for the pregnancy, the fibroids are benefiting from those changes as well. And so increase in blood flow means increase in growth for the fibroids. It has more hormones and more nutrition coming in. So pregnancy is growing and fibroids, they're thriving as well. And so with that, you may notice that there's a significant amount of growth that occurs then. Now, if you're here, you're probably thinking, or you have just found out about these fibroids. So you had no idea that they existed. And your question that led you here is, am I pregnant? And this pregnancy has caused these fibroids to appear. And more than likely, they did not develop during your pregnancy. More than likely what has happened is that they've grown, and now that you're doing ultrasounds and taking a look at your pelvis and you're looking at the baby and all the things, now your sonographer says, wait a second, there is a baby. Baby is doing well and thriving and moving in the direction that it needs to. Maybe it isn't. They're not always the most beautiful pictures and good stories that come from them. But now that we're looking at your pelvis, we may identify them and just know that the likelihood is that they've been there before and they're just not surfacing, they're not developing, they're not coming about for the first time now during pregnancy. Now, there are so many other things that can play a part in these fibroids and their growth during pregnancy. Your genetics are closely linked as well. If you are Black, we know that there is genetic changes that actually makes fibroids worse in Black women. It makes the growth of fibroids even faster in Black women. And Blacks may identify and know that they have symptoms from fibroids much earlier on because fibroids develop much sooner in your system compared to others. Now, during pregnancy, most fibroids will stabilize after the first trimester. They may still grow just a small amount, but a majority of them will not grow as much as you go through the second and third trimesters. Sometimes you can have something called degeneration of your fibroids. And this is where during pregnancy, the fibroids may start to change form. This is because of the changes hormonally and the vascularization that's happening. These fibroids may start to break down. As they start to degenerate, what can happen for you is that you can start to have extreme, severe pain right in the area where your fibroids are located. So for instance, I'm with fibroids as well. I did not know about my fibroid until pregnancy. And during pregnancy, in that first trimester, I started to have some degenerative changes and extreme pain. Pain that prohibited me from, or inhibited me from walking well, from being able to exercise and function normally because the fibroid was changing form. And any change in the form of the fibroid may lead to pain, sometimes fevers, things that small pain meds might not necessarily help with, but things that are very real and very much present. Fibroids may also lead to having preterm labor. You may have difficulty with your delivery, as baby might not be in the right position because of the fibroids. Sometimes it could be that the fibroids make your nausea and vomiting pregnancy extremely, extremely severe. Fibroids can have a lot of different impacts. But what I want you to get away from our video and our conversation today is that the likelihood is that they're not developing newly during pregnancy, but your pregnancy may cause them to change. And sometimes that is the first time that you will identify that you have these when you're getting your sonograms done in pregnancy. Now, I hope this video has been helpful for you today. And if so, drop a comment below, share your experiences. Again, they're very common. So I know a majority of you watching today have fibroids, whether you know or not. And so they may have impacted you in some way. So share, let's talk about it. And if you're interested in learning a little bit more, there's another video that I think will be extremely helpful as we discuss this topic. Check the link below this video and go ahead and take a look. Thank you so much for being here today. I'm Dr. Perkins again, and it's always a pleasure.